So I also know that I need some packing strips. So I'm going to go ahead and cut my packing strips. Okay. So this is kind of a little far for me. I'd have to lean like way into my sterile field to see. So I can do sterile and sterile, put my sterile Q-tips in there, and I can move this closer so I can see. And then I can go ahead and reach inside there for my packing tape. Then I'm going to get the length that I want, I'm going to cut it, and the rest of it will sterilely drop in there. And I put this in my kit, and I know that I need 2 pieces. Cut my second piece. Okay, then I'm good. Okay. Now I want to create a sterile field around my patient. Okay. I always tell students the bigger your sterile field, the less likely you're able to become contaminated. And when you're a novice, it's better to have a big field. Okay, so if you got 5 drapes, use them all. You're good. And go ahead and open your drape, and again, you're going to just open it carefully. Okay, you're not going to shake it to open it. You just open it in that controlled movement, because we talked about in infection control how you don't shake things. Now I want you to notice that on this drape, one side is shiny and one side isn't. Okay, these drapes have a moisture barrier, and so does this tray. Okay, it's got a shiny side. And the good thing about that is that actually is a moisture barrier. So remember in the movie when we watched and it said if your field gets wet, it's contaminated and you have to start over? That's because those were fabric, and the wicking of microbes can happen through the fabric. When you have a moisture barrier, that wicking won't happen. Okay, so you're going to notice that most of your prepackaged kits like this in the hospital are going to have that moisture protection. It's usually in the OR or specialized trays like a chest tube tray and different things like that that will have just the linen ones. Okay.
So if you get it wet on the top side, is it then contaminated?
Mm-mm. Because it won't wick through because of the moisture barrier. Okay. So the sunny side or shiny side goes down.
Hungry?
Okay. Yeah. And so when I put the drape on the patient, notice how I'm holding my hands. Okay. I'm not putting my drape down like this because now my hands have left my visual field and I'm going to contaminate my fingers. Okay. Then I'm not sterile anymore. So when I'm placing a drape, I'm going to put this over my head so you can see. I kind of hold my hands like this, so my fingers are covered. So my hands will remain stable or sterile. So when I put this over my patient, then I can adjust it using that sterile field. I haven't contaminated my fingers. Okay, so I can use that. I do have a second drape in my kit. So maybe I want to put this one on the other side of Mr. Butts. So now I can hold him here while I'm doing my stuff. I can hold him here. I might put another sterile drape over here. You know, whatever makes you feel good to try and keep sterile. So in our video, you remember that lady, she was really packing that wound with like, what, 3 yards of packing? And it was kind of dragging over the patient's skin. What I would have done, okay, because packing really should remain sterile, is I would have taken this whole container of like 3 yards of packing tape, and I would have opened that and dropped that into my sterile field, and now I would pick it up and put it here, so when I was packing him, it would be dragging over from my sterile field. Okay, so that would have been an option for something like that as well. Okay.
When shouldn't the wound remain sterile too? So like when you just reach your hands over, it's okay to do
This wound? Yeah.
Like
the
when you just put the other side on,
Mm-hmm.
you
Mm-hmm.
reach over it. Is that okay?
Right. So I should have put the back drape before the front drape. That would have been okay. Yeah. So I'm going to be removing the drape so you guys can see. Okay. And so now I'm ready to do my wound care. Okay. So first of all, I know that I'm going to need some saline in for my moist dressings. So I'm going to add a little saline to my tray. Okay. And then for the purposes, we know that when we're irrigating a wound, the more irrigation the better, because we're washing clean the wound. Okay. For the purposes of our checkoff, you're not going to use like 60 milliliters of saline. Okay. So what you'll do is you'll say, okay, I'm going to irrigate the wound until the solution runs clear. Okay, that would be the right answer. That's how long you irrigate it for. Sometimes it takes 60 mils, sometimes it takes a liter. It kind of depends on what you're doing and how big the wound is. So when I'm done, I'm going to put that down. So after my irrigation is complete, I'm going to dry out. Now most of this would have run out of the patient, but I am going to dry off the wound. Okay, and so I'm going to bunch up some gauze, and then I'm going to go into the wound bed, and I'm going to dry it off. So are my hands sterile right now?
Yes.
No, why not?
Touch the wound.
Because I put it in the wound. So in the purest sense of the word sterile, my hands are not sterile anymore. Okay, but for this wound dressing change, they are sterile, because my sterile hands, or once sterile hands, are in the patient's wound bed, which is the patient's wound. Okay, and the goal of this procedure is not to bring anything to the wound, but if I'm taking things away from the wound, that would be okay. Does that make sense? So you're right, in the purest sense, it's not sterile. Okay, so now I've irrigated the wound, I've dried it out. I'm also going to dry the outside of the skin, because with irrigation, that's also going to get wet. I'm going to dry that using that circular motion from the wound and out. Okay, and then I'm ready to repack my wound. Okay, and so I have my Q-tips. And I'm going to take my packing tape and I'm going to pack the wound. Now, the best way to make sure that your packing doesn't get sterile, and this is a practice pearl, so this is my opinion, okay, is to maintain control of your packing so your hand kind of becomes a dispenser. Okay, if you hold it like this and you're packing, it's going to drag on the patient's skin, and then it's going to become contaminated and you'll have to start over. So I maintain control of my packing strip. I say that a lot, don't I, Tom? I've got control issues. So I maintain control. He knows. When I'm packing my wound, I'm also going to leave a tail of that packing so that it's easy for other people to find. Because once in a real wound, this is going to be wicking out serosanguinous fluid from the wound, so it's going to look very similar to the wound. Okay, so it needs to be easy to find. So I'm going to hold this up. You see how I left all the tail? So everybody see it, so it's easy to get it. I didn't pack it way in there. Okay. So now I'm going to take my moist gauze and pack the wound as well. So I'm going to take that gauze that's wet and I'm going to wring it out. Okay. Now, I'm not going to put really tight gauze like this in the wound because it'll just become a rock. It won't really be very helpful to the wound bed. I'm going to open it up and I'm going to fluff it out. Okay? And then my open gauze becomes like a ladder for fluid to wick out of the wound. Okay? If I have it too tight, then things can't go anywhere. And the goal is to really to wick out moisture and bacteria out of the wound. Again, I'm using my hand as a dispenser. I'm packing the wound under the undermining to support that wound bed underneath there.
So you go around the edges and then you fill it with
You can do it, it doesn't matter really how you pack it. Okay, you're going to pack it so it's even throughout, but usually you start on the edges of the wound because then you can pack outward, but as long as it's packed. You know, some people go all around and then just the inside. Some people go one side and this way, and it doesn't really matter. So let's say this happens. Now what? It's contaminated. So that's called real life. So I'm going to throw that away and I'm going to get a new one. Okay? As long as you identify that you contaminated and what you would do, you have a solution for it that's realistic, then you can just continue.
If that's contaminated, then do you have to take off the gloves?
No, because it's his wound. It's still his wound bed. Yeah. Then the next level is to put the dry dressing, the dry gauze over that. It's going to help wick when you go from moist to dry. It's going to wick out. Okay. And then the ABD pad. And now, after I pack the wound and I start putting gauze on top of it, sterility is really not that important anymore, right? So at this point in time, if I'm adjusting him and touching him, my wound's already covered, I'm good, okay? I could take off my gloves to tape, like they did in the video. I usually leave mine on, but it's kind of, you'll learn with time, it is kind of annoying to tape with gloves on. Sometimes when you have body parts that have lots of folds in them, it's difficult to get a tight seal with your tape. And so my strategy for that is I usually start in the middle of the wound, okay, and I'll tape down that way and then move to the outside of that body fold. And then that way it kind of isn't that it's going to pucker and things can get up underneath there. I'd want to be especially careful with this wound because it is in the coccyx area. It can be, he obviously looks like he's been incontinent, right? And so I want to make sure that the wound stays clean. I might ask the wound nurse or the doctor, even on a wound like this, if it was okay for that first like half of the dressing, if I could put an Opsite or a Tegaderm over it to give it a little bit more of a barrier, so that if he was incontinent, that wouldn't get into the dressing, and then wick microbes the other way, right? Okay. So then I'm going to get a piece of tape. I'm going to write my initials, date, and time on the piece of tape, and I'm going to label the dressing so everybody knows when it was changed last. Okay. Then I'm going to say, okay, Mr. Butts, I'm done with your dressing change. Can I get you anything else right now? I'm going to clean up the area, get rid of the wet barrier. I'm going to reposition him back to his position of comfort. Okay, and what else am I going to do?
Lower the bed.
Lower the bed, give him the call light. That's your terminal fail. Side rails up, lower the bed. That's a patient safety issue. There's no room for mistakes there.
You don't want to take your gloves off before you.
Really, theoretically, my gloves aren't dirty, you know, because it was a sterile procedure, but you could too, and do hand washing. Yeah. Those were tight. Size 7 hands and 6.5. Okay,